Om Swastiastu. We are from SGDB10 and will present about pedophilia. Knowing about pedophilia is crucial in the effort to reduce the number of pedophilia cases, hence to enhance the quality of society, especially the mental health quality.
Hello, my name is Aurelius Robertus Novito with NIM 128. Pedophilia is a sexual attraction towards children. Pedophilia is a type of pedophilia, which is a sexual stimuli or acts that deviates from the normal sexual behaviors but are necessary for some persons to experience arousal and orgasm. Most cases coming to public attention are girl victims. However, offenders report that when they touch a child, 60% of the victims are boys. This is a contrast to the victims of non-touching pedophilia such as window peeping or exhibitionism, with girls making 99% of all victims. Pedophilia in Indonesia is still a serious matter. In Indonesia, there are several public known cases of pedophilia. One case that makes the headline is 2014 pedophilia case that involves a student from Jakarta International School or GIS, in which the 5 offenders were deemed guilty and imprisoned for 7 years. Thank you for your attention.
My name is Krisata Paramita Karnyamaya with student number 170. The purpose of this writing is to find the answers for research questions including first, what is pedophilia? Second, what are the epidemiology, etiology, diagnosis, classification, and differential diagnosis of pedophilia? Third, how are the treatments of pedophilia? Lastly, what are the medical legal aspects of pedophilia? The benefits of this writing are public can acknowledge the importance of understanding treatment and medical legal aspects of pedophilia, build academic community's knowledge and authors' knowledge about pedophilia. Lastly, authors can fulfill their student project assignment of Behavioral Changes and Disorders block of Faculty of Medicine, Udayana University.
Okay, doctors, my name is Komanjani Putri, number 031, and I want to tell more about the definition of pedophilia. Pedophilia is a disorder characterized by sexual urges, fantasies, or repetitive behaviors that involve sexual activity with children, boys or girls, which can be caused by traumatic experience, chemical abnormalities, or defectures. Pedophilic desire is the tendency in adults to have sex with children. Pedophilia is a type of paraphilia, and the pedophilia is quite rare in women and more common in men. Pedophilia appears to be a lifelong condition by the patients.
Hello, my name is Madeline and my number is 093. And now I will continue the discussion about the epidemiology of pedophilia. The incidence number of pedophilia is difficult enough to get because as individuals, mostly unwilling to admit as a pedophilia. Approximately, the prevalence of true pedophilic sexual preference is 1%, although in investigation, the prevalence of people with pedophilic general fantasies can reach up to 5%. And there were some studies that suggest the prevalence around 3% until 5% in general population.
Good morning, doctor and friends. My name is Sharon Kalista, NIM 015. Now let's move on to discuss the etiology of pedophiles. So, a substantial amount of research has been performed on what leads someone to be attracted to children. The questions such as do people choose to be pedophiles or are they born that way? These questions remain as a medical controversy. However, in this presentation, I will try to explain some factors based on previous studies that can cause someone to be pedophiles. First one is neuropsychiatric differences. So, research that seeks neuropsychiatric differences between pedophiles and general population has been undertaken, and it is reported the differences include impaired cognitive abilities, neuroendocrine differences, and brain abnormalities. Based on study of Cohen and Gallenker, there are 30 to 55% of impulse control disorders such as personality disorder, kleptomania, pyromania has been noted in pedophiles, which indicates that pedophiles may have neurodevelopmental disorder. In addition, a study by Blanchard et al. In 2002 saw an increase in pedophiles levels in people who had suffered serious head injuries as a child, especially before the age of 6. A secondary finding of the study was that individuals who were pedophiles were more likely to have mothers who received psychiatric treatment and controls. Move on to the brain disorder factors. There are a study by Skifter et al. In 2007 that uses the MRI techniques, found that the pedophiles in the study showed decreased gray matter volume in some parts of the brain, including in the temporal lobe. It has long been known that certain medical conditions can lead to hypersexual and hyposexual behavior. In addition, personality disorders such as post-traumatic stress disorder is also known to cause changes on functional neuroimaging of the brain. Last but not least is the environmental and social factors. There is a relationship victim to abusive cycle or abuser phenomena, which increases the chances of an individual becoming an offender as if he or she were sexually abused as a child. And it is reported there are 28 to 93% of pedophiles who are abused as a child. The stress and trauma will cause inhibition and regulation to their growth and can cause them to fantasize or engage in sexual activities with children, which later can cause them to have academic difficulties.
My name is Inyoman Wigraha Yoga with name 109. Today I will explain about the diagnosis of pedophilia. Pedophilia is a type of paraphilia. On the diagnosis and statistical manual of mental disorder or DSM, in the 5th edition, they tells the difference between paraphilia and paraphilic disorder. People with paraphilia doesn't mean they have paraphilic disorder. There are two criteria to decide that. Criteria A is the defining present for the paraphilic erotic interest, like pornography material, and the criteria B is impairment, significant distress, or acting out the paraphilia with non-consenting person. If they have only criteria A, it means they have paraphilia. But if they have both criteria A and B, it means they have paraphilic disorder.
My name is Marco with name 057. Today I will present about the diagnosis criteria based on DSM-5 on pedophilic disorder. Okay, based on DSM-5, the diagnosis criteria for pedophilic disorder are: first, individuals who have intense sexually evoked fantasies, sexual desires, or behaviors, including sexual activity toward prepubescent children, usually as 13 years or younger. Second, acted on sexual desires and urge which cause them distress and interpersonal difficulty. Third, turn 16 and at least 5 years older than the victim. Okay, the diagnostic features for pedophilic disorders are applied on both to individuals. First, individuals who freely acknowledge themselves, and second, individuals who oppose any sexual desire to prepubertal children, although the evidence show the contrary. Okay, how do we differentiate the pedophilic disorder and pedophilic sexual orientation? If the individual admit that their sexual attraction toward these children causing them psychosocial difficulties, we can categorize them as a pedophilic disorder. On the contrary, if the individuals do not feel any shame, guilt, or anxiety toward these impulses, and their legally recorded histories show that they have never done based on their impulses, then we can categorize them as a pedophilic sexual orientation. Thank you.
So my name is David, number 74. So I will explain diagnostic criteria based on PPDGJ 3. Diagnosis of guideline of pedophilia based on pedoman, penggolongan, dan diagnosis gangguan jiwa 3 classifies pedophilia as sexual preference to a child, it may boy or girl. Usually the target victim is pre-puberty or early puberty period. Most of predators were men, rarely women become pedophilia. The preference must be repeated and settled. The diagnostic includes in an adult male that has a preference with a normal adult sexual partner, but in chronic frustrating condition to achieve sexual intercourse which is expected. So he switched off his habit to a child as a replacement.
So my name is Anish Sharma with name 1920511251. Differential diagnosis of pedophilia can be differed from obsessive compulsion disorder or the influence of alcohol or drugs. So for pedophilic disorder, there are considerations to made by doctor in ruling out of the diagnosis, and based on DSM-5, it has been relatively obvious that the obsessive compulsion disorder has an impact in causing an involuntary, intrusive, and an ego-diagnostic sexual thoughts of children. However, a person who is suffering from obsessive compulsion disorder can also find such images and thoughts to be loathing and also disgusting, and hence trying to resist and ignore them according to the DSM for obsessive compulsion disorder. And also the DSM states that when a person who chooses sexuality in adults may also engage sexual behaviors with children when they are actually under influences of alcohol or drugs. Although the DSM-5 differentiates this behavior from pedophilic disorder, however, it is arguable that the unconditioned effects of substance can release abnormal desires, which is then suppressed by the individuals while they are in sober in vino veritas.
I am Futura Natalie Anggreni with student number last digit 117. Treatment for pedophilia is all usually comprehensive and intensive, involving pharmacological and physiological intervention over months to years. Accurate assessment for pedophilia is necessary for effective treatment. Therefore, comprehensive assessment is required by several methods, including clinical interview and structured assessment instruments such as ABEL assessment for sexual interest. ABEL's assessment for sexual interest is an alternative assessment for sexual interest purpose for admitting and not admitting child molester and not admitting accused child molester. Pharmacotherapy and for pedophilia has focused widely on the global reduction for sexual drive. Anti-androgens have been in use for years. While effectively in reducing sexual drive, anti-androgen has side effects such as loss of libido. Gonadotropin-releasing hormone is longer acting and has fewer side effects. SSRI is also give better tolerated alternative, and several open-label trials have recommended efficacy with paraphilias, including pedophilia. Pedophilia can be also treated by drugs. In the United States, doctors use medroxyprogesterone acetate, which is injected intramuscularly. Another alternative is leuprolide. Medroxyprogesterone and leuprolide stop the pituitary gland from signaling the testicle to produce testosterone. They reduce the sex drive and testosterone level.
Hello, doctor and friends. My name is Giovanna Ferencia, student number 148, and I will explain about the medical-logical aspect of pedophilia. Pedophilia is considered as a crime in many countries, including Indonesia. In Indonesia, there are rules in Undang-Undang Nomor 17 Tahun 2016 said that chemical castration applied to punish the pedophilia as a protection to the victim. As a physician who treated human, doctors in Indonesia had a dilemma related to doctors' ethic code in Indonesia. Castration considered to violate the profession oath because of its effectiveness and complication remain unclear. Castration means a surgery action or use of chemical drugs to remove the reproduction function in testes or ovarium. The decrease of testosterone hormone can affect the body function such as muscle atrophy, lack of blood, and impaired consciousness. In Majelis Kedokteran Etik Kedokteran Number 1 in 2016, Indonesian Doctor Council rejected to do castration for pedophilia. On the other side, castration have side effects to physical condition that may lead the subject to do more extreme crime. A heavy crime such as pedophilia may sentence to chemical castration from the court, but doctors should not be the one who execute the suspect. The court should look for another person to do the castration, so doctors will not break the ethic codes and still uphold the humanity.
Hello, doctor and friends. Thanks for the challenge. My name is Putu Emilia Dewi with 3 last digit of student number 028. So, as a summary, pedophilia is a disorder characterized by sexual urge, fantasies, or repetitive behaviors that involve sexual activity with children. The incidence number of pedophilia is difficult enough to get because as individuals, mostly unwilling to admit as a pedophile. Some theories have been proposed on what leads someone to be attracted to children, such as neuropsychiatric differences, brain disorders, and environment or social factors. The diagnosis of pedophilia can be done with some classification criteria based on DSM-5 and PPDB10. Treatment for pedophiles is usually comprehensive and intensive, involving both pharmacological and psychological interventions. There are a lot pros and cons about what punishment is worth to give to the pedophilia, such as castration in Indonesia. In other way, doctor should not be the one who executed the suspect. The court should look for another person to do the castration, so doctors will not break the ethic codes and still uphold the humanity. Well, this is the several or some references we use on these student projects. And that's all we can explain of. Thanks for your attention and have a nice day.